Professor, do you see a big difference in terms of the burden of disease of psoriasis between low, middle, high income countries?
First of all, there's a high level of burden from psoriasis in almost all in basically all countries, regardless of the level of income of people or the health system. Nevertheless, in countries where there's less access to treatments, there may be a longer period of suffering for the patients, or there may even be no access to modern drugs which are essential to relieve patients from the burden.
Do you really think this should be a priority in low-income countries where we have so many communicable diseases killing so many patients?
I think, first of all, there is no rule how to allocate the spendings in the health system, which always are scarce, and you always need to decide where to spend the money for. But especially patients with high degree of severity of psoriasis, the suffering is even higher than in many other chronic diseases which are maybe more well known or more in the front.
You're involved in the Global Psoriasis Atlas project. How's that going to help low-income and medium-income countries in particular?
In all countries, especially in those with low and medium income, there's high need for data, because decisions in the healthcare system, especially when there's a shortage of money, need to be driven by data, not just by gut feeling. And for those countries, it's essential to show that there's a high burden and a high number of patients affected from psoriasis which deserve accurate treatment.
Do you see a significant socioeconomic difference in terms of the impact of psoriasis between low, medium, high income countries?
Regarding social relationships and the problem of stigmatization, there probably is not much of a difference. However, in low-income countries, the impact on the level of poverty or the level of expenses may be different in many ways. For example, in low-income countries, patients need to pay more from the income for accurate treatment, and this is a much higher burden than in countries with a high income.
Does psoriasis have a significant effect on patients' ability to work productively?
On average, across all countries, it's an impairment of more than 4 days missing at work. And also, beside of the days missed, there is a trend to less productivity at work, which we call presenteeism. And we know that in severe psoriasis, both adds the absenteeism, the days lost at work, and the presenteeism. And overall, it's a challenging problem in severe disease.
Do patients with psoriasis find it harder to get a job?
They do. In many countries, patients with psoriasis suffer from being rejected when they have appearing invisible lesions, and they may be very limited to professions where they don't have contact to the public. Moreover, patients who suffer from arthritis have less opportunity to get into jobs where they need their hands, and these are many jobs, of course.
Professor, thank you very much indeed.
It's a pleasure.